What is the difference between succinylcholine and rocuronium? Well, first, let's explain what these drugs are. Succinylcholine and rocuronium are both paralyzing drugs. Why on earth would we need to paralyze a patient? We need to paralyze a patient when we're putting in a breathing tube, because paralyzing the patient allows us to put the breathing tube in easier and quicker. And let's talk about why I would pick one versus the other. Succinylcholine will get me to good intubating conditions in about 30 to 60 seconds, which is really good if I need to get there quick in an emergency. Rocuronium in the right dose can get me there in about 45 to 90 seconds, okay? So you got about a 15 to 30 second difference maybe. Sometimes in emergencies, that time matters. Most of the time, the difference between 5 to 15 seconds might not make much of a difference. And a lot of people are choosing to use rocuronium nowadays because many years ago, we didn't have a reversal agent for rocuronium. So you'd give the drug and you'd have to let it just kind of wear off essentially. Succinylcholine works very fast, like I said, about 30 seconds, and it comes off very fast. I'm talking a few, minutes, 5, 10, 15 minutes, something like that. Rocuronium will last 15 minutes to an hour, sometimes more, sometimes less, depending on the patient. Rocuronium, because it's reversed so easily, has the benefits of acting almost as quick as succinylcholine and reversing it almost as quick as succinylcholine as well with sugammadex. So some reasons though you want to avoid succinylcholine additionally is people who have like potassium issues, things like that. And then there are reasons also to avoid rocuronium. The other big downside to succinylcholine is that succinylcholine causes a lot of myalgias or muscle pains because it's a depolarizing agent. And that means it goes to the muscle nerve junction and it causes a depolarization. It means your muscles contract. And when all your muscles contract, you can get really bad muscle cramps and soreness afterwards, which you can prevent that, the data shows, by preemptively treating with NSAIDs like Toradol, ibuprofen, things like that. Some people also will give a little baby dose of rocuronium before they give the succinylcholine. That's been shown helpful too. As far as the risk goes, besides that, there's no big risk difference between the two. I think there might be a slightly higher incidence of allergic reactions to rocuronium compared to Sux, but allergic reactions with these drugs are still pretty uncommon. I hope that helps.